YouTubers? We've got Bree back in the house. Bree's our video girl. She is how many weeks?
31.
31 weeks pregnant. Amazing. Just this week we've had, or last week I should say, 35, 37. One of our patients was 40 weeks right on the day she was due. She came in to get adjusted. She had her baby 2 days later, and she was just in the office yesterday for a follow-up. Fortunately, easy childbirth for her. It was her 4th baby, and already back in for chiro care. She says, how soon can I come back in? As soon as you're able and willing to get back up and move, and that's awesome. So chiropractic care is safe. You've heard us in other videos. Safe for pregnancy. It really helps to reduce back pain, hip imbalance, strain throughout the body, neck strain, mid-back strain from the ever-changing body position. Body weight obviously is going up a little bit as the baby grows, so we do have more stress in the body through the ligaments, the muscles, the connective tissue, and the skeletal system. And what we're doing with Bree to start off, just a nice little shoulder check and a nice little scapular check to see where she's feeling it at, and she is just a little bit tighter over on this right shoulder versus left shoulder, which from our previous appointments we know she's had more right side neck irritation. It could be due to her sleeping on the right side, something that we do through a computer. Exactly, tons of computer work, lots of imbalance up in the right side neck, which is most people's common areas, like right side. Same in the lower body, right side leg. From driving with the foot out causes a lot of imbalance down into the leg and ultimately migrates up into the pelvis. So guys, we're going to use Hypervolt just to get some nice circulation, some movement up into the right neck, right shoulder. Feels really good too, right? I will tell you guys, our patient that was in yesterday with the 1-week-old baby delivered down at West Penn, which is a hospital down in Pittsburgh, and her husband brought in the Hypervolt so that as she was laying in bed during her contractions and during, well, not during delivery, but as she was waiting for delivery to happen, her husband got to massage her back a little bit. She says, it was the best thing, he took care of me. And even the hospital nurses, one of the hospital nurses who is a weightlifter, a CrossFitter, said, you're the first person to bring a Hypervolt into the hospital, which is kind of cool to hear. But these are great. If you guys don't have one, probably every household in America will have one at some point. It's good to exchange, you know, husband, wife, or if you have a partner, exchange 10 minutes of your time and get a little back massage. It'll brighten up your day. It'll loosen up your back, loosen up your neck. You guys can check out our Hypervolt videos. Some of them are self how-tos and some of them are partner how-tos. And for Bree, we're just going to work up in her right shoulder. And the Hypervolt provides a nice therapeutic vibration movement to help resonate and loosen up some of the tissues around the spine, around the shoulder blade, gradually improving circulation, reducing muscle tightness and muscle tension, helping her to feel better for a couple days, maybe a couple weeks. When we pair this with stretches and exercises, you maintain your adjustments longer, your body stays looser, and we want to see progress every appointment, that things are loosening up a little bit better. How have you felt?
Really good.
Good. First trimester was the toughest?
Yeah, I just was sick all the time, but after that, I've been feeling really good.
Nice. Usually the first is the toughest. Second, from what I hear with patients in here, and what my wife went through with our baby was, some people get sick, some people don't. Usually that's over by the first 12 weeks. Second trimester sometimes is, now you're just kind of pushing through. Third trimester is where the body and the baby start to grow much more. Definitely more stress on the lower spine, the lumbar spine. Common that a lot of women that come in that are pregnant may also get some rib pain. that radiates around from like the mid-back because the abdomen is stretching so significantly. And you know, also common to have like round ligament pain, inguinal discomfort. So we'll see how Bree stretches out today, and you guys will get to see how we get a 31-week pregnant female adjusted, and we're going to do cervical spine, thoracic spine, lumbar spine, and we will also just gradually stretch her feet out to help provide some relief. Cool? Mm-hmm. Cool.
Sounds good.
Sounds good. Let's go. Look down straight for me. And we're going to go back to the right side. And guys, we'll do, you know, a couple minutes, 2, 3, 4 minutes on each side, right side, left side. I like to go, you know, I like to start on the tighter side, move to the looser side, which is her left side, and then we'll come back for a second round through the right neck, the right shoulder, driving a little deeper down into the mid-thoracic spine, and then right up around the shoulder blade. Also good to get out here on the scapula a little bit, into the infraspinatus region, which is one of your rotator cuff muscles, and then even up higher into like the trap and the supraspinatus region. You can pull your head to the left for me. All right, good work. And pre-adjustment, Hypervolt helps us to just loosen some of the soft tissue structures up a little bit. But we are still going to dive a little deeper. Hold right there for me, Bree. And then, you know, Bree's job duties entail a lot of computer work, a lot of video editing, photo editing. Oh my. And so she does commonly just get a little compressed, a little tight up in her neck. Headaches, some people just deal with more headaches than other people. When your neck gets irritated and compressed. Bree, you've had migraines in the past.
Yeah, I've had a lot of migraines and headaches. You know, not recently though. Like definitely the chiropractic care has helped a ton, and I don't get them nearly as much.
You feel a spot right here though, this right side. So when we first met Bree a number of years ago, she was real tight up in her neck, and she's probably one of the top people that have taken a lot of the go-to stuff and the exercises and the neck stretches and incorporated a ton of them at home, right?
I try to learn from you.
A little bit here and there, right? Mm-hmm. Look down for me. Look up. Look down. Look up. And then what we're feeling on Bree, up in Bree's neck here, is her C2, C3, which is your second and third cervical vertebrae, and a little bit of tension way high up in the suboccipital region, which is occiput and C1. Look up, look down. And if you're compressed up in your neck for a long period of time, you can have a whole host of systemic, full body symptoms. So some people can have digestive irregularities, breathing irregularities, heart palpitations, vagal nerve stress, and upper suboccipital or upper cervical spine stress can just throw the entire body out of whack. Common complaints: neck pain, headache, shoulder pain. More uncommon complaints, but still linked together to spinal cord dysfunction, is going to be abdominal thorax dysfunction, so problems with the heart, the lungs, the digestive tract. Look up for me, down for me. Up, down, and then left, and then up, down, left, up, down. Stay right there for me, good. And then you guys might see on the video, let me wipe this off here. Lean your head to the left. You guys might see this tight band that pops out right here, right? And this is where we want Bree, when she leaves the office, to, as you guys have seen in so many other videos, just kind of passively stretch your neck, lower your right shoulder. Do you feel that pulls? So she's got to be doing this stretch throughout the day. She's got to be elongating this band right here that, you know, computer work and driving with the right hand up and sleeping on the right shoulder. So many complicating or, you know, so many different factors that play into maintaining a nice, healthy musculoskeletal system. Elevating the head throughout the day, working on your thoracic spine posture. A little bit of hypervolt at home. And a little bit of neck stretch at home. Lean left, lean right, lean left, lean right, lean left, lean right, and left. Hold right there for me. Lean right, lean left, lean right, lean left, lean right, lean left, good. Lean right, lean left, lean right, lean left, look down, good. Right, left, right, left and down, right, left and down. One more time, right, left and down, good. Relax for me. All right, good work, good work. Stand up. Guys, this table has a breakaway, so it's got a little pregnancy release. Bree, you're gonna put your belly right in here for us, okay? Let that beautiful little baby girl take a little rest right there. So, if you're pregnant, if you haven't been to a chiropractor before, you know, a lot of questions come through. When can I start? Do I need to start before I'm pregnant? It's always better to get your body loosened up a little bit before pregnancy, but we do have a lot of women that will come in, you know, week 25, week 30, week 35. My back's been killing me for months. You know, what do I do? Well, we're gonna work a little bit, but as that baby grows, there is a lot more stress through the body, so it's important to try to get as balanced structurally, your skeleton balanced. Get some important exercise knowledge so that you can stretch a little bit throughout the day, early in the first trimester, and the whole way throughout pregnancy. It makes your body way more pain-free, and you know, the baby can sit healthier the more that your hips, your legs, your lower back is stretched out, and things just get a little easier. Pregnancy gets easier for people.
I have had a lot of tightness in my calves.
Yes, good.
I photographed a wedding last weekend and just like wrecked my legs.
All right, let's do a little hypervolt treatment down there then, okay? All right, nice. And well, we're going to start up here first, okay?
Yeah.
So with the hypervolt in pregnancy, we do treat around the pelvis. We're not going to do anything up in the abdomen, obviously. We don't want to shake the baby up too much, but we do want to get a little bit of movement down here. It is therapeutic for the pelvis, for the hips. It helps to release tension in the pelvic floor, and it does and will help to get some good movement into the sacrum. And also helps these like leg muscles, the glute med, the glute min, the IT band, some of the muscles that run down into the lateral leg. You okay?
Mm-hmm.
And we're going to go right over the sacrum here for a few. And then guys, people always ask what setting is best. There's 3 settings on the Hypervolt. I personally like to use setting 2 for most patients. Very few patients have too much sensitivity with setting 2 where we need to back it off to setting 1. And then I just think 3 is a little too much for most people. It's a little faster, stimulates a little more, it becomes a little more sensitive, the tissue becomes a little more sensitive. But setting 2 is like your nice moderate moderate vibratory effect that I would probably say 95-98% of people can handle setting 2 pretty nicely. And then we're gonna come down, and Bree had she had a wedding last week, you said?
Yep.
Hours and hours of standing?
Yeah, 8 hours.
And she said, my calves were wrecked. So Hypervolt to the lower extremity helps us to, again, loosen up the muscles around the tibia and the fibula, the 2 bones down in the lower leg. It also helps with fluid reduction, a little bit of lymphatic drainage, a little bit of stimulation down here to the arteries, the veins, the capillaries, and gets blood moving a little bit better. Important to just reiterate, when you're standing for a long period of time, it's not going to hurt to do some like knee raises or, even a quick little back stretch, a hip hinge stretch, if you can kind of break away from the wedding for a minute when you're not taking pictures or videos, and just stretch a little bit, especially when you're pregnant. You gotta stay nice and loose in your backside. Strong but loose, that's what we like to say. And then guys, we'll use the Hypervolt kind of like in a parallel fashion with the leg. Just kind of moving up and down the calves a little bit. You okay?
Mm-hmm.
Tender on the inside or the outside?
A little of both, but mostly outside, like down by my Achilles.
Like down here?
Yeah.
How's up here feel?
Not too bad.
I'm not feeling anything too major. Doesn't hurt to pause a little bit if you want to work on a specific area a little bit more. Most of us are going to get the medial calf. The medial calf's the inside calf that sometimes gets a little tighter back here behind the knee. And then also down into the medial compartment of the leg where the posterior tibialis is. And then out here on the lateral side or the outside of the leg where your muscles called your peroneals are. All right, nice. Nice. Now that feels, is this the ankle that's the crunchy one you were talking about? Or they both kind of crunch a little bit?
I feel like they're both going to adjust.
Yeah, bend here. All right, good work, good work. Push into my hand. And stop. And push. And stop. You guys can see how much awesome push, flexibility Bree has down in her lower extremity. Push. And stop. Have you been sitting in the rocker a little bit? Push. And stop. Push one more time. And stop. This is where you're going. Back down. Good. Left leg up. Push. Stop. Push. Stop. Push. Stop. Push and stop. And this stretch is really nothing. This anterior chain push, this anterior chain stretch for the quad. You guys see how we're kind of plantar flexing the foot, getting the heel out a little bit. This exercise really helps the toe extensors, the muscles in the top of the foot, the side of the ankle or the top of the ankle, and then down here into the shin to just, stretch out a little bit. All right. Decent, really good work in both of those areas. Okay, deep inhale, deep exhale, all the way down. Oh, piece of cake, all the way down. Good, deep inhale. Good, all the way out. Nice, deep inhale, deep exhale, all the way down. Good, one more in. And down, all the way down. All right, good work, girl. Now we're going to roll to the left. We're gonna roll over to the left side. And then I'm gonna lift this up here. There we go. That's right there. Okay, so guys, Bree's 31 weeks. We've got, just did an awesome piece of cake thoracic spine adjustment. All the vertebrae bumped nice and easy. We're gonna do a side posture. And breath in, exhale out. Good, other side for me. Decompressing the low back with some lumbar adjustments. Really good to help provide pain relief. Safe to do with the baby. Breath in, exhale out. All right, fighting back. Good work, girl. She's healthy. Bones are moving, joints are adjusting. And if she stays right through here with what she's done up to this point, I can't ever say delivery is going to be easy because it's different for everybody. But you will feel really good.
Mm-hmm.
All right, good work. And it is obviously common, guys and women on the channel, if you've had somebody you know that's pregnant, or your partner or your significant other, swelling can occur down in the lower extremity. There's obviously, things kind of grow in the abdomen, veins, arteries, nerves can get compressed, causing fluid retention down here in the lower extremity. So it is super important, as we do with all of our patients, squeeze your toes down, point your feet down, focus on squeezing or activating your left calf, your left foot, and then your right calf, your right foot. Okay, so back and forth, pump the muscles. We're gonna add in one thing. After you do about 10 reps, 1, 2, 2, 3, 3, feet up towards you, get nice straight legs, pull your toes up to your chin as hard as you can. Try to feel how this stretches the back of the calves a little bit. Twist your knees open a little bit, pull your toes up towards your chin. Focus on left foot, pull up, and then right foot, pull up. And just try to feel how that stretches the back of the legs, and then always reset back down and in like this. Okay, cool. All right. Nice. One more here. That side's good. That's your good side. Okay. Bend up here. Easy with the knee. Nice. And easy with this knee. All right. All right. Hands. Guys on video, I just like to check all the joints. Relax here. Let's see if this guy works today, all right? There we go. Little elbow adjustment to help free up some tension in the medial compartment, which is like that inner elbow joint. Relax here. Nice. Nice. All right. And then lastly, up into that right side. But we're going to do the left first. Turn. And turn. Nice, girl. She's healthy. Guys, we got thoracic spine, we got lumbar spine, we got cervical spine. We got feet, ankles, double elbows. That's my treatment. That's how I like to adjust patients. Bree did awesome. Her body is healthy. I will tell you, we do not always see that. Gently roll to your right side, and then you're gonna sit up, okay? We do not always see that. Many times when you're a new patient, if you've never been stretched on, worked on, if you don't do our exercises, your body's twisted, your muscles are tense throughout your body, your joints don't want to release just yet. And as we undergo specific exercises, specific adjustments to different parts of the body, we balance it all out. We get your skeleton to look nice and straight. We get your pain out of your knees, out of your hips. Where? All right. And Bree is like one of our all-star patients. Love it. Thank you.
Thanks so much.
Good work. Guys, we might see her one more time before baby delivery, so yeah.
Or like 36 weeks probably.
Nice. We're going to get that on video as well. And if you got any comments, drop them below the video. If you got any questions about chiropractic care and pregnancy, drop them below the video. We'll be happy to answer anything that you guys shoot at us.